If you are looking for a vitamin to possibly stop your proteinuria and boost your kidney health, then stay tuned. Today we shall talk about that particular vitamin. This vitamin not only prevents proteinuria, but it also increases kidney function. Isn't that amazing? Well, let us dive right into the video, shall we? Understanding proteinuria and kidney function. The kidneys are far from just a crucial organ in the body. They work non-stop to keep things balanced. In short, they are responsible for carrying out the purification process within your blood via filtration of impurities and excess fluid. Through this, they help regulate your blood pressure and maintain electrolyte levels. So they do their job without you even noticing it. But sometimes things can go wrong. Enter proteinuria. It is a way of saying that your kidneys let protein into the urine, a condition which is rather common. Think of it as something like a leaky faucet. That is a sign that something is off with your kidneys. So why does it matter? Well, your kidneys are the prime component of your body which helps it perform in the best way. If they function to their best, then they promote good health, preventing heart issues, kidney failure, etc. So what is the importance of kidney function? See your kidneys as the life guardian which is making sure that everything is okay. All the muscles and organs of your body are interrelated and they work together to keep your system balanced. That is, to make you feel healthy and happy. But when kidney function declines, it is like the control center goes haywire. In this system, you begin to accumulate trash, push your saline and fluid levels to the wall, and your blood pressure rises. It's basically a disaster. This is why active monitoring of our kidney health with the immediate treatment of health problems is a must. This way, you will learn what proteinuria is and why kidney function is vital. This empowers you to take action and make sure your kidney health is not compromised. Role of vitamin D in kidney health. Now let us explore in detail how vitamin D helps to support the functioning of the kidneys. Do you know how you often associate vitamin D with sunlight and strong bones? At this point, I can actually tell you that it is not only a vital nutrient, but also one of the most versatile nutrients. Yes, it's really good for our bones, but it's also a major help to the kidneys as it serves to ensure their smooth operations.
Your kidneys receive vitamin D in an extremely specific manner. There are special receptors for vitamin D present in your kidneys. And when they receive this vitamin, they keep their blood pressure and kidneys in check.
Vitamin D helps you against certain renal diseases known as proteinuria. For some of you, this already sounds like a big word, but it is basically when too much protein ends up in our urine, indicating a potential kidney issue. Vitamin D is the protective shield of our kidneys. It blocks the leaking of extra protein produced by the kidneys. But here's the thing. When a kidney cannot receive the optimal vitamin D, it will not function normally. They are more likely to get impaired and might have an extreme likelihood of developing proteinuria as well. Hence, the fact that there is a need to get sufficient vitamin D is unequivocal. Signs and symptoms of vitamin D deficiency. Let's talk about something super important. It is the vitamin D deficiency signs and symptoms. Kidneys and vitamin D work together. Therefore, one should know that a low level of vitamin D can impair an individual's general health, particularly when dealing with kidneys. To begin with, the deficiency of vitamin D is more common than you might imagine, especially during the winter months when sun exposure, which is the primary source of vitamin D, is limited. Well, how do you know if there's not enough vitamin D? What are some clues that the amount of vitamin D in your blood might be below what is needed? Well, the first symptom you usually notice is fatigue. If you feel exhausted even after a full night of sleep, you had better check whether the situation is because of your lower vitamin D levels. Another indicator that can reveal one having a vitamin D deficiency is when they slowly lose muscle strength or experience muscle weakness or pain. For example, you could find yourself noticing that your muscles are painful or you are not as strong as before. Furthermore, it will lead to a decrease in muscle function and strength. Vitamin D takes part in the process that regulates the level of calcium and phosphorus in your body, and these substances are very important for the good working of the kidneys. When your vitamin D is low, it results in mineral imbalances, which are another reason for straining your kidneys, resulting in added stress. In severe conditions, the person might develop proteinuria, which is an increased amount of protein found in the urine. Further loss of kidney function might also occur. In conclusion, if you are having any of these symptoms, especially the ones that last longer or are significant in severity, it's essential to consult your healthcare provider. Has this video been helpful so far? If so, go ahead and share it with your friends, family, and loved ones. After all, let them also learn about the wonders of vitamin D and the importance of kidneys. You can also like the video to show your support. And there is more to come, so stick around till the end of the video to learn more about this world. How vitamin D stops proteinuria. Imagine your kidneys as the ultimate defender of the body's filtration system. This is empowered with a strong but efficient sieve that is called a glomerular filtration barrier. Its main task is to separate the blood. This is done by blocking the waste products from going out and leaving the essential proteins and nutrients in the blood. However, when the same selective barrier becomes weak or compromised, it results in proteinuria. This is the presence of excess protein in the urine as a result of protein sneaking, which can cause harm. And now, here's the part where vitamin D comes in. Studies indicate that vitamin D contributes to the formation of the protective filtration barrier by causing the expression of specific proteins within the kidney cells. This relates to the structure of the glomerular barrier, whereby these proteins can be viewed as a reinforcement that is responsible for its strengthening and maintenance of integrity. But indeed, vitamin D packs more than one punch that goes ages beyond just bone health. These compounds come with impressive anti-inflammatory properties. It has been attributed to aiding the kidneys by decreasing the process of inflammation in renal structures, therefore protecting kidneys from damage and inflammation-related complications. These two functions that are reinforcing the glomerular membrane and lowering the amount of swelling with the help of vitamin D may eliminate proteinuria and kidney dysfunction. Henceforth, by providing our bodies with a plentiful supply of vitamin D, we are inhibiting the process of kidney dysfunction and proteinuria, increasing kidney function with vitamin D. Next, let us examine the function of vitamin D with regard to having healthy kidneys, and especially preventing chronic kidney disease, also known as CKD. Vitamin D is the most powerful anti-inflammatory compound that interests many health specialists. In CKD, inflammation in kidneys may result in quicker destruction of the organ, and the function of the organ may be compromised. Vitamin D then interferes by soothing down the inflammation that had built up, and the kidneys no longer have to be overloaded. Thus, proper healing is promoted. The second reason is oxidative stress, which contributes heavily to kidney damage. It especially happens in situations when the cellular production of harmful radicals cannot be neutralized with antioxidants. Vitamin D is an antioxidant that tries to counteract these free radicals so that the kidney is not vulnerable to the damaging effects of oxidation. Moreover, fibrosis, the excessive growth of scar tissue in kidneys, can be progressive and lead to damage to the kidneys. Vitamin D is shown to prevent the formation of fibrosis by its regulative effect on processes that are responsible for organ shape and function. Besides this, together with its effect on RAAS, vitamin D is also vital for controlling blood pressure and fluid balance in the body. In RAAS imbalance, the mechanism of hypertension and fluid retention is also disturbed, which in the long run can harm the kidneys. By tuning up RAAS, vitamin D prevents the accumulation of fluids around the kidneys, in this way maintaining the normal blood pressure. In essence, vitamin D is the guard that protects the kidneys against inflammatory and oxidative stress, fibrosis, and also RAAS. This is how vitamin D supplementation can slow down the progression of CKD and reduce the risk of kidney failure, so these patients can live a more normal life. I hope this video has helped you understand everything you need to know. If so, go ahead and share it with your friends, family, and loved ones. You can also like the video if it has been informative. And if you are looking for more videos on health, you can subscribe right away.